And we're back. I tell you what, we have gotten so many emails from you. Listeners asking about anti-aging. And I've learned that that is a big word now. It's not just, anti-aging. And we found, I'm telling you, we found one of the best clinics in town. I just spent 15, 20 minutes talking with you, and I learned more in 15 or 20 minutes than I have listening to anything you hear on the radio. So, first of all, let's introduce yourselves.
I'm Elizabeth Harris.
Michael Beedix.
Okay, so we have, and the name of your company is Radiant Imaging?
Radiance Age Management.
Okay, because I saw like 3 or 4 different names. I went, which one is it? But you're in Palm Beach Gardens.
Palm Beach Gardens.
So, and you're easy to get to. Tell me about your practice.
Well, you asked about anti-aging, and it's true. I mean, the word anti means against. We're not against aging. Our practice is really more about functional medicine and about the whole person. And we do anti-aging treatments as a part of that, but we're as much interested in people's holistic health as much as just only hormonal balance.
So you go back to their history, physical, you're not just, okay, we're going to heal you, cure you with this. You're about finding out about them first.
We are medical professionals. I'm a physician. Elizabeth's a nurse practitioner. And we go back the old-fashioned way. Because there's 2 things that we know about. If you ask somebody and ask the right questions and listen, people will really tell you what's bugging them. And then number 2 is the blood doesn't lie.
Oh, that's right. So if you're watching right now, let me tell you, they're both a little bit over 100 years old. So this shows you how, no, I'm just kidding you. How long have you been in practice for?
Almost 2 weeks.
Okay.
No.
But
I'm just
see,
kidding.
he's getting me back now.
Now, collectively, we've been in practice a long time. I've been in practice for almost 40 years. And Elizabeth, I was happy to say, I met almost
14 years ago.
14 years ago, and she's been in the same field for a very long time. Between the 2 of us, we have a lot of experience in functional health and hormone balancing.
Okay. Now, the first question I have to ask you is, what is ED?
Well, you know what? We are actually, may I say, we are actually going to focus this show on sexual health, and we thought we would do is men's sexual health. We have a whole show coming up.
You do women's too.
On women's sexual health and women's functional health and women's hormone balancing. But we want to talk a little bit about men's sexual health today, if we can. ED typically means erectile dysfunction. I hate that word. I prefer to use the word erectile dissatisfaction because dysfunction means it doesn't work at all.
Right.
Dissatisfaction means you'd like it to work better.
Right.
And that's really what we sort of pride ourselves in, is finding out what's going on and what can we do to help men get better functional sexual health.
Now, I know everybody's body's different, but I know there's people right now sitting there going, yeah, but will it work for me? That's the first question that would pop up in my head because a lot of people don't understand what you do. They see these ads on TV, and you don't want to go by those ads.
Here's what we do know. At one point in your life, it was working. The question we ask is, why is it not working now?
Now, okay.
Right? And that usually is a difficult question. Are we talking metabolic? Are we talking physiologic? There's a bunch of things that we have to go and look at in order to answer that question. Sometimes in life, as you know, the answers are easy. It's the questions that are hard.
I understand what you're saying. So it's not like they're going to walk in and you're going to give them a pill. That's not how you practice.
Most of our male clients have already tried one pill or another.
Okay.
They spend a lot of money on pills that work or don't work, so we're already beyond that.
So I was also surprised we talked about age. I asked you what's your medium age group. I was surprised how young it was.
What would you say?
Our youngest is 19.
Yeah, I would have never thought that.
Oldest is 91.
Wow. Now, is that both for male and female?
Oh, you asked. We're talking about males, but women not that far off.
Wow. See, I would now. So on a 19-year-old, they weren't producing enough testosterone.
You know what? Sexuality is a bell-shaped curve, and as you know, because there are sexuality is a broad brushstroke. For some reason, typical males just did not produce enough testosterone. Now, sometimes there are important reasons why that's true. There could be brain tumors and all kind of stuff that we have to look into, but we see that. Typically, another reason, certain medications, certain drugs, men who are using narcotics typically have real issues with testosterone.
Okay, so there's a reason to quit if you're doing narcotics.
Could be.
Now, I also heard blood pressure has something to do with it, too. If you have high blood pressure.
Look, what we do when a client comes in is what the first thing we want to do is
I'd love you to walk us through
an overall holistic approach. We need to look at, yes, we need to look at all the factors. How well did you choose your parents? What do you do for a living? We have to look, and we look at blood. We need to look at your liver, your kidney, your cardiac risk factors. Are you diabetic? Are you pre-diabetic? Is your thyroid working? There's a list of things.
Whole workup you do.
You got to do the whole thing.
So you actually do blood work.
Oh, you have
when they come in.
A very,
Required.
very extensive blood work, and a complete physical exam. And we're going to do some things that your male clients, most of them, have never had done. For example, when's the last time you had a breast exam?
I try to get one once a month. I heard that's what a male's supposed to do.
You never had one, and I'll tell
I
you
haven't.
something. And you know something? Breast cancer is alive and well in men. It's
Wow.
not. It's yes, and when a man gets it, it's devastating. And
How
we're
would a
not-
man know he has it? though?
and you might not know, but I tell you, we may not be the smartest people in the world, but we know exactly what you find when you don't look, which is nothing. So doing male breast exams, doing testicle exams, doing exams on men's lymph nodes, rectal exams, prostate, we're going to do all of that stuff. We don't start treating until we've done a complete exam and a complete blood work on people.
And is everybody treated different once you put them through this physical exam?
Everybody in our clinic is a one-off.
Okay.
Everyone's got different parents, different metabolic functions, different blood tests. There's no two people that are the same, which makes it interesting for us.
Okay, so this is the first time I've done a show like this before. So if I stumble a little bit, so what are some of the reasons why a man would not perform?
Well, let me just say this.
No one's listening.
Okay.
You can whisper.
There are basically 4 or 5 things that a man has to have in order to have a good sexual function, to have good sexual health, to have good sex. Here they are. Number 1, the penis has to be architecturally intact, which means there are some men with conditions called Peyronie's disease, with serious bends in the penis to the point where they can't even penetrate the vagina.
Wow.
Yeah, so if you've got, those are horrible. There are men with some horrible disfigured conditions that we need to look at that. So you got to have architecturally sound. Number 2, the wires have to be intact. So anything
You're
that
going
has
to tell me what this means, right?
well, prostate surgery, low back pain, any kind of conditions, and
Low back pain
MS.
would keep from an erection?
Oh yeah, I mean all the pain fibers that come to your low back and your pelvis are right there. Men with chronic low back pain are going to have difficulty performing.
Wow.
You think about it.
I've never heard that one
Well, think
before.
about it, you know. So anything has to do with neurologically. The neurological balance is really important. That's number 2. Number 3, libido,
Okay.
drive, the alpha dog.
Okay.
You got to want to.
Yeah, I would think so.
Right. And you'd be surprised. Now, this is primarily testosterone. And we should talk a little bit about the whole testosterone measuring process. Every day, not occasionally, every day, men come to our clinic who have been seeing good doctors and have been told that, yes, your testosterone is low, but it's not low enough to treat. So
Is that true?
Not to us. Our world is not about the bell-shaped curve. In our world, you are either optimal or you're not.
Okay.
So, so that's an important.
And what does that involve? Is that, I mean, if that's one of the problems, low testosterone, how do you treat that?
Elizabeth, how do you treat that?
We can do injections, creams, or pellets. Injections, creams, or pellets.
Okay, see, I didn't know you do the pellets. I've heard some incredible, I read some information about the pellets, how good they're performing.
We insert them
And they last for
subcutaneous.
6, 7, 8 months or something like that.
Well,
The article I read said 6 months.
that's probably generous.
Okay,
Yeah.
I'd say about 3 to 4 months
okay.
on average.
But they work, I heard.
They work really well, and they're great for the Florida lifestyle because a cream will melt off in the
That makes sense.
And
Where do you put
if
a
you're afraid of
pellet
needles,
at?
you don't want to do injections every week either.
Where do you put the pellets at?
Into the fat layer in the buttocks.
Oh, okay.
Surgically
side.
inserted.
Okay.
Yeah.
But I heard a lot of good things about pellets.
There's pros and cons about each and every one of our methods, and that's why, as Elizabeth mentioned, everybody is different. And so coming into our clinic, we have to first of all figure out what's going to work for you and
Okay.
what the options are.
So you have different options with testosterone.
Lots of options.
Okay.
Right.
And then what else?
For,
We were talking about there's 5 things.
oh, yeah, I was going to give them all to you. So libido, of course, this is the testosterone. And then, of course, the big one is blood flow. I mean, look, penis. It's basically two bags stuffed in a skin sack. And you got to get blood to it if it's going to work. Blood flow is the thing that we deal with the most, and it's what most of the medications are about. When you look at the Viagra, the Cialis, this is all about blood flow. So what are
Can
some...
you actually change blood flow?
Oh, you have to. In fact, and so this is one of the things going back and looking at men who have conditions that may be related to blood flow. Look, if you've got vascular issues, if you've got blood pressure, or if you've got coronary bypass, if anything that decreases blood flow is going to decrease blood flow in Mr. Happy as well.
Wow.
Right. So one of the important things that we deal with on a regular basis is just that, it's blood flow. And Elizabeth's going to talk a little bit about what our options are for treating blood flow.
Gosh, I never realized that you could actually change it. So that's what those pills are supposed to do?
Oh, the pills were designed as blood pressure pills.
Wow.
Yeah, think about
The
this.
the little blue pill?
Yeah, here's how they work, basically. If we want to think about this as an analogy, if you got a garden hose in your hand and you leave the spigot alone, water's coming out of the garden hose, right? If you double the diameter of the hose, what happens to the pressure? It goes down, right? So that's how blood pressure pills work. We were hoping that the Viagra, for example, would work in that way as a blood pressure pill, but it doesn't work for blood pressure. It only works in the periphery.
Gotcha.
The face, the nose, Mr. Happy, and that's how these work. But they don't always work, and they have a lot of side effects. So for men who are looking for other alternatives, we have some wonderful alternatives.
Well, we're going to go to break right now. Give everybody your phone number
561-335-3246.
and your website.
RadianceAntiAging.com.
We'll be right back. This is a great topic. We'll be back.
Men, regain your confidence and performance in the bedroom with the Gains Wave therapy at the Radiance Age Management in Palm Beach Gardens. Gains Wave is a revolutionary ED treatment that is non-invasive and pain-free. Gains Wave is a scientifically validated therapy to restore blood flow, helping you perform better and last longer. To see if Gains Wave is right for you, call Radiance Age Management at 561-335-3246 in Palm Beach Gardens, or visit online www.radianceantiaging.com. Screenings are always free. You can be spontaneous again.
You can just psychiatry joke. I like
So we're
that.
back, and we're talking about the actual subject is anti-aging, but it really isn't, and I guess you can tell by now. And we are with the Radiance, the anti-aging, I want to say management, because you do so many things. I mean, I didn't realize, first of all, there's so many things to look for. And I got to tell you, because we talked to a lot of companies before we found you, is they don't do all this blood work, this big workup. I mean, you literally do a history and physical before you go anywhere.
We are recovering conventional practitioners. That's right.
So we were talking about blood flow. So explain that.
So the blood flow, the penis has to have adequate blood flow.
Yes.
Okay. And without that,
Forget
nothing
it.
rises to the occasion. And I just want to point out that men,
I know you guys are doing
men
this on
go
purpose.
to the doctor because they lose their erection or they're not satisfied with the sex that they're having. And they don't talk to anybody about it. Women, we talk about everything. We talk
Right.
about our periods, when we start, when we stop, our hot flashes, and the sex
hear
we
those
had,
every
and we
night.
share it with anybody we feel like. Men share nothing. They tell. It's like don't ask, don't tell. So when a man comes to a doctor's office and says, I'm either not having erections or they last for like 2 minutes and then it's gone and I'm embarrassed and mortified, something's wrong. And it's not really the penis itself necessarily. It could be the heart. It's going to be the arteries. It could be the veins. You could be hypertensive. You could be diabetic
back
and
pain.
uncontrolled. It could be nerve tissue that's being compressed, that's altering his sensation and his penis. Therefore, he's not able to climax. So there's a lot of things that go into the male erection. So that's why we take such a long, comprehensive, deep approach to how can we fix this? Because when this gentleman comes in to me, I might be the first provider he's seen in 5 or 10 years. And we could be dealing with some serious health issues that could be giving him problems in 5 years from now if we don't address it.
Right.
Besides his penis.
You know, the people I spoke to sound like they're going to hand you a kit right away and go home, give yourself a bunch of injections, nutraceuticals,
Many of them do.
and that's it.
That's right.
So, and like you said, like everybody's body is different. You can't give the same thing to one person as you do to another. And I guarantee you, today, I'm telling you, I can't wait for next month because I know there's women going, what about these hot flashes? Stop talking about the men. I have hot flashes every night and can't sleep. So, women, we're going to get to you next month.
Yeah, we won't forget you. So the blood flow, we have Gainswave and P-shots. So the Gainswave is the non-invasive, no needles, no medications option.
Okay, tell me about this, though.
It's acoustic shockwave therapy.
Wow.
And what it is...
Painful?
Not really.
Okay.
Without having a penis myself.
All I care about is can I go to work the next day?
Yes. We can apply a numbing cream to the penis shaft and to the testicles if needed, but most men don't even need it. So what it is, it's a device that sends little sound waves
Okay.
through the skin, through the dermal layer, and it breaks up the vascular congestion.
Wow.
So there's pooled blood, okay? Just like
Okay.
you can get pooled blood anywhere else in the lower legs and things like that.
And how
then
often do you have to have this done?
twice a week,
Okay.
minimum of 3 weeks. So
Okay.
for 6 treatments minimum. It's recommended 6 to 12.
Gotcha. Okay.
Okay. And each session lasts about 20 to 30 minutes. And like I said, most men don't need a numbing cream, but we can apply that if they prefer. And around the 3rd or 4th treatment, that's when they start seeing major changes. So, for example, if a man is taking the Viagra or Cialis, we can either eliminate the need for the medication or at least reduce the dose. Okay?
And that stuff's expensive.
It is
so
expensive.
that's good.
It is expensive. And with the P shot, it's platelet-rich plasma. So we're taking your own cells. We draw your blood.
Okay.
We draw it in the office. We spin it in our centrifuge. And then we siphon off the plasma portion, which is the liquid portion. Okay? And then we inject that back into the body. And that gets injected into the penis.
Wow. This is amazing. There's so many things out there.
The fluid she's talking about contains stem cells, cytokines, and growth factors. So we're basically taking a concentrated form of your own material, putting it into the penis, into those skin sacs that we talked about, to improve and rejuvenate the penis.
You know, I already trust you already because I know you've been practicing for a long time. Tell me, do you like stem cell?
Stem cells?
Yes. Because you're using it in some ways.
I think you have to be. Listen, there's so much hype about stem cells. It's buyer
Right.
beware, okay? Yes, there are some wonderful applications for this. There are some people out there who are taking advantage of the concept. So it's It's buyer beware.
Okay.
We're very judicious about that. We have one approach that we like. We have found that the combination that, and Elizabeth does the treatments, does the combination of the gains wave and the P-shot is a wonderful approach to help men gain better sexual function.
So with all this, I know there's people out there right now going, where does the loss of weight come in?
Look, now we're going back to our functional medicine part. The whole thing about taking somebody who wants to lose weight, gain muscle mass, have more energy, turn the clock back 15 or 20 years. This is what we mentioned before. This
Right.
is the old joke about the psychiatrist. How many psychiatrists does it take to change a light bulb? One, but the light bulb has got to want to change.
Right.
So there's no magic. You still have to participate. There's still diet and
Do you put
exercise. We
you
talk
put
about
your
all
patients
these
on
things.
diets?
We talk about all these things, of course. We have some diet options for men and women that we talk about. If we don't do it all, we're not doing any of it well.
How long, I know people are going now, how long when they sit down with you for the first time? How long do they sit down with you for?
The very first meeting, maybe
Because that's
20
when all
minutes
the
just to get a
blood...
feel for what they need. And then we draw their blood.
We should point out that our first meeting is free.
Okay. Oh, good.
FREE. And the reason we do that is because we may or may not be a good fit for someone.
Right.
And we want them to be comfortable. We can do that by phone or we can do it in person.
Okay. So now what are your hours?
Typical 9 to 5.
Okay, because I'm thinking, hey, I'm at work. I might be in Miami, and I want to use you. You could actually do this over the phone.
The blood review we can.
Yes.
Yes, and then after we are fit and someone decides that we are fit for them, then we draw the blood. After the blood is drawn, and then what we do, it's a pretty comprehensive, it's about an hour and a half consultation with us to go over all the stuff that we can't do this in 10 minutes. It
No.
takes us a long time to really dig in.
And you give them the blood results.
We do.
Okay.
Yeah.
Because I've actually seen those like 3 or 4 pages long.
It's
but
a lot of
everything.
educating. And
Yes. And it still tells you what the medium is, what you
it
should
gives
be
you a
around.
reference range. And
Yes.
What's important to know is we stopped telling people what to do a long time ago. Our job is to empower clients to make decisions based on understanding the data. We want you to understand the blood test, and the decisions, you're a smart guy, the decisions will be easy to do once you understand what these data mean.
Tell me about some of the feedback you get after someone has been 2, 3, 4 months. What kind of feedback do you get? I'm sure you
they
get
don't
some.
want to come off of it.
I know. That's what I would think.
Yeah.
Because
the
you've got to feel
combination-
better, too.
We change lives forever.
Yeah.
This is amazing. You know what? Let's give everybody the phone number again.
561-335-3246.
And you got a great website. Whoever did your website did a wonderful job. There's a lot of great information on there. What is your website?
RadianceAntiaging.com.
I'm going to tell you something. And next month, we've already discussed it. We're going to talk about the females next month. And listen, you get in at what time in the mornings?
8 to 9.
Okay. Call first thing in the morning. Set up an appointment. Remember, you come in the first time. It's free to sit down. And you can actually sit down with them. You're going to probably have a lot of questions for them. And I'm going to tell you something. You want to get to the blood work, though. That is the most important thing. Because you really can't do anything unless you look at the blood work.
That's right. And,
And it should be like that.
Right. Not only look at the blood work, but we pride ourselves in taking a lot of time in sitting down with you so you understand what is a BUN, what is HbA1c. This is not rocket science.
You might find out about something. You might have a problem, something you never even knew about.
Every day. We find issues every day with people who may have good physicians. Every day we find something that we need to identify and deal with that they may have not even known about.
Because your blood work sounds like it's pretty extensive.
It's very extensive.
I mean, it's going to cover just about anything.
And our exam is extensive as well.
So, I always in the show, tell me why I should come to your practice.
I'm not sure you should, really. The more I think about this. You tell you
May
what,
I?
we should. Do you?
May I?
You, please, yes.
So one of the most common things that a new patient will say if they bring their own labs from Dr. Smith, these are my labs from my doctor, and he told me everything's fine, but I don't feel fine.
Wow.
Why do I not feel good? And that's probably that's the most common thing that somebody new would say coming in. And then I look at their labs, and it's like 3 or 4 items, and it's unremarkable, but it's not everything that we do.
Right.
And I mean, my approach would be to keep digging until you find something abnormal. If someone says, I don't feel good, and everything looks normal, well, we have other tests too. We've got food sensitivity tests, we've got telomere testing, we've got micronutrient testing. There's so many things that we can do. And it's not that I want to find something that looks bad.
Yeah, but
If someone says they
usually,
feel
you know,
bad, you got to find
someone
something.
feels.
There's got to be some science behind their sensation.
And you know, are they, when a doctor does it, are they as extensive? Because you order the blood work. Your labs know what they need to look at.
We actually define the blood tests. We're medical providers. So
Right.
That's what we do.
So sometimes I would think maybe the doctor didn't order everything they thought, they left something off. Because I've actually seen those reports. They're pretty extensive.
Well, part of it is because the insurance companies only allow you to do so much. We're not really hamstrung by that. We are going to look at what the patient needs, not what the insurance company needs.
That makes a big difference.
Yeah.
I love what you guys are doing. And listen, we're an older, more mature area of Florida. And listen, I still like the word anti-aging. I can't wait for you to come back next month. We're going to take care of the females next month.
We will.
Thanks so much. We'll see you next week.
Men, regain your confidence and performance in the bedroom with the Gains Wave therapy at the Radiance Age Management in Palm Beach Gardens. Gains Wave is a revolutionary ED treatment that is